Hello everyone. November 14th every year is also celebrated as World Diabetes Day. So, as a primary diabetes treating physician, I thought it is my duty to continue to create awareness about diabetes and reiterate on certain well known facts about the same. I'm very sure most of you know quite a bit about diabetes today, but I'm also sure there is something new to learn every time. So, why are we all talking about diabetes? Why is it so concerning? Let us see. Diabetes mellitus literally means sweet urine. So, what happens is there is one major hormone in our body, amongst many others, called insulin, which is responsible for blood glucose control in our body. So, when we become either partially or completely deficient in the hormone insulin, or when there is associated resistance to the action of the insulin hormone in our body, we become diabetics. So, what happens? The blood glucose levels start increasing slowly, and when they cross a certain level, it comes out of the body in the urine, thus making it sweet. So, why are we all concerned? Why is diabetes so deadly? Why is it so serious? Why does everybody talk about diabetes day in and day out? This is because diabetes is a lifelong disease and it is a lifestyle disease. And if we don't control the sugars efficiently, we might end up in one complication after the other in a chain reaction manner. So, what are the types of diabetes that we have? To be very frank, there are very many types of diabetes. But for practical reasons, to make things easier for us to understand, we broadly classify them as type 1 and type 2 diabetes mellitus. What is type 2 diabetes? This is the one which we commonly see in our practice day in and day out, most commonly seen in adults. But unfortunately, today, due to various lifestyle changes and genetic factors, probably, we end up seeing them in young adults as well. But they can be brought under very good control with good lifestyle modifications, a very good diet, exercise regimen, and medications as needed. And these patients do not always require insulin for their glycemic, that is, sugar control. What is type 1 diabetes? Type 1 diabetes is the one that we commonly see in children below the age of 15 years. But yes, we do rarely see in young adults as well. These patients are completely, absolutely insulin deficient, and so why we are all concerned about type 1 diabetes is because they need insulin, maybe 3 or 4 shots of insulin a day, lifelong at present. The next type of diabetes, which we are increasingly seeing today in our OPDs, are gestational diabetes mellitus. What is this? Gestational diabetes is something that we identify or probably recognize for the first time in pregnancy. Most of them have diabetes in this variety during their pregnancy, and the sugars normalize after delivery in quite a few of them. Then you have something called the secondary diabetes, where it is due to other reasons like drug induced or could be some disorder of the pancreas, some endocrinopathies, which I don't want to get into detail at present. There is another very interesting form of diabetes that we all see today, increasingly, probably because of the advancements in genetic testing. This is called as MODY, that is maturity onset diabetes of the young. These individuals are usually young diabetics with a very strong family history. And the good news is they need very minimal medications and do very well with dietary and lifestyle modifications. So, what are the symptoms of diabetes? When should one get tested himself or herself for diabetes? When should we contact our physician? What are the complications of diabetes? We shall see this in the upcoming videos. Thank you.